Hello, I am Dr. Ujjwala Keskar, Consultant Pediatrician at Manipal Baner Hospital. Today I am going to talk to you about what precautions we can take to avoid diseases which are occurring in the monsoon season or the rainy season. We know that in the rainy season we have got rise in the dengue fever, viral infections, conjunctivitis and the acute diarrhea or the gastroenteritis. Now for the dengue fever, we know that it is because of the mosquito bites. So the best way is to avoid the mosquito bite. So always whenever you are going out of the house, wear full sleeved clothes, use the mosquito repellents, and then the best thing is to prevent the production or the breeding of the mosquitoes. So how we can do that is you should avoid water getting stagnated around your house. So in the tubes, in the tires, in the open buckets or in the pots. Now so many houses have plants in their house, so you should keep precautions that the plates which we keep under the pots should be dry. And anybody who is having high fever for 3 days with headache, with retroorbital pain should consult the doctor immediately. As far as the viral infections are concerned, we know that the children do fall sick and they are having runny nose, high fever every time, and every 3-4 days they are okay, and again after a week they are again falling sick. So the best way to prevent is to have the influenza vaccination. So that is given by the pediatrician from the age of 6 months to 5 years. And when you are having common cold, you should always cover your mouth when you are sneezing, talking or coughing. You should avoid contact with a person who is having cold. And the best way is to keep washing your hands repeatedly. You should avoid getting wet in the rinse and do not stay wet for long time. Whenever you are traveling outside on a bike, always cover your nose, mouth and the ears. That will avoid your exposure to the cold air. If a child is having conjunctivitis or if the parents are having conjunctivitis, they should avoid sharing the handkerchief or the towel which has been used to wipe his eyes. Wash the eyes repeatedly and you should put the eye drops regularly. As far as the acute gastroenteritis or the loose motions are concerned, you should always use the boiled and cooled water for drinking purpose, use the home cooked food and always cover the food so that the flies will not sit around it. If to take all these precautions, I think we will be able to prevent most of the diseases which occur in the monsoon. Please, anybody is having above symptoms, do visit Manipal Hospital Baner, Pune.